Ya, Wida, ini kan buat ini.
Halo Ibu. Sudah bisa masuk Bu? Sudah masuk bisa? Saya bisa nggak masuk bed? Saya masih bed
Pak, ya antara sekarang
Mau makan dulu, aku dapetin aku sikut mantar SP.
dari
Antar kelas itu si roda.
Ya, karena pakai laptop ya. Coba saya buka laptop dulu ya. Iya, iya.
Datang pada acara wisuda dan angkat sumpah Sekolah Tinggi Ilmu Kesehatan Abdi Nusantara, program studi pendidikan profesi nurse, sarjana keperawatan, diploma 3 keperawatan, pendidikan profesi bidan, sarjana kebidanan dan diploma 3 kebidanan tahun akademik 2021-2022.
Izinkan saya untuk menyampaikan rasa terima kasih kepada para orang tua asuh, istri, suami, ponakan, mengucapkan selamat kepada para wisudawan dan wisudawati atas keberhasilannya
enough with you, and I'll never let you go. I'll never say goodbye. Together for eternity. Oh, I've loved you since the dawn of time, with twin flames burning bright, and I can't believe that I finally found you. Cause nothing is better than you and I together. I just wanna stay until the morning sun. Lay here forever, you and I together. I just wanna stay until the morning sun.
Wisuda dan angkat sumpah Sekolah Tinggi Ilmu Kesehatan Abdi Nusantara tahun akademik 2021-2022 hari Selasa tanggal 26 Juli 2022 saya nyatakan ditutup.
And I will be fine. We belong together.
Senat Akademik Sekolah Tinggi Ilmu Kesehatan Abdi Nusantara meninggalkan ruang sidang.
You and I will be fine. We belong together. Nothing is better. My first day on earth.
Kami mengucapkan selamat datang pada acara Wisuda dan Angkat Sumpah Sekolah Tinggi Ilmu Kesehatan Abdi Nusantara, Program Studi Pendidikan Profesi Nurse, Sarjana Keperawatan, Diploma 3 Keperawatan, Pendidikan Profesi Bidan, Sarjana Kebidanan dan Diploma 3 Kebidanan tahun akademik 2021-2022.
Finally found you here. 'Cause nothing is better than you and I together. I just wanna stay until the morning sun. Lay here forever.
Izinkan saya untuk menyampaikan rasa terima kasih kepada para orang tua asuh, istri, suami, donatur. Mengucapkan selamat kepada para wisudawan dan wisudawati atas keberhasilannya menyelesaikan studi di STIKes Abdi Nusantara.
I just wanna stay until the morning sun. My first day on earth, you sang me a tune. Forever won't be long enough. Somebody said they saw you. The person you were kissing wasn't me, and I would never ask you. I just kept it to myself. I don't wanna know if you're playing me. Keep it on the low, 'cause my heart can't take it anymore. And if you're creeping, please don't let it show. Oh baby, I don't wanna know. I don't wanna know. Hold you. When looking in your eyes, I can't believe I don't need to know the truth. Baby, keep it to yourself. I don't wanna know if you're playing me. Keep it on the low, 'cause my heart can't take it anymore. And if you're creeping, please don't let it show. Oh baby, I don't wanna know. I don't wanna know.
STIKes Abdi Nusantara, unggul, unggul, unggul.
Can't take it anymore. Somebody said they saw you. The person you were kissing wasn't me, 'cause my heart can't take it anymore. And if you're creeping, please don't let it show. Oh baby, I don't wanna know. I don't wanna know. About it when I hold you, when looking in your eyes, I can't believe I don't need to know the truth. Baby, keep it to yourself. I don't wanna know if you're playing me. Keep it on the low, 'cause my heart can't take it anymore. And if you're creeping, please don't let it show. Oh baby, I don't wanna know. I don't wanna know.
Mahasiswa Abnus. Lagi cari pasien, lagi kunjungan rumah. Ada tatapan satu ini.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. My name is Alia. It is wonderful and precious chance for me to be a master of ceremony in this beautiful morning at STIKes Abdi Nusantara, Jakarta on Monday, 3rd of July 2023. In our big event, Kuliah Pakar, optimizing pregnancy outcomes by involving family in pre-conception period of midwifery care. First of all, let's say thanks to Allah Subhanahu wa Ta'ala, who has been giving us guidance, happiness, healthy, and mercy, so we can attend and participate in this event without any obstacles. Praise and salutation upon our Prophet Muhammad SAW, the best figure of this universe. The person who was able to save us from the darkness to the lightness, Mina Zulumati ilan nur. In this beautiful moment, I would like to welcome Dr. Kerry Hampton, RNRM, from Monash University, Australia, who will be the speaker at our event today. The Honorable Dr. Mariati Sutarno, SPD SST BD Mars MH, as the leader of Abdi Nusantara 2002 Foundation. The Honorable Mrs. Lia Idealistiana, SKM SST BD Mars, as the leader of STIKes Abdi Nusantara. The Honorable Mrs. Mariani SSIT BD leader of the midwifery study program STIKes Abdi Nusantara. The Honorable Mrs. Lili Farli Hatun BD MKEP as the leader of the midwifery diploma study program STIKes Abdi Nusantara. Thank you for the presence of Mr. and Mrs. the lecturer of midwifery study program STIKes Abdi Nusantara, and welcome to all participants of the guest lecture today. On this special morning, we have several agendas. Here are the agendas. The first is opening. The second is singing Indonesia Raya, hymn, and march STIKes Abdi Nusantara song. The third is prayer. The fourth is reciting visi misi. The fifth is welcome speech. The sixth is the core event of the guest lecture. The seventh is discussion. The eighth is submission of certificate and grades. The ninth, the documentation. And the last agenda is closing. Step on the following agenda is the opening. Let's say Basmalah together. Bismillahirrahmanirrahim. The second agenda is singing Indonesia Raya song, hymn, and march STIKes Abdi Nusantara. For this one. The next agenda is reciting prayer. Will be recited by Nurse Asep Barka, STIKes. For Mr. Asep, time is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Selamat pagi, salam sejahtera bagi kita semua. Hadirin yang berbahagia, marilah kita berdoa dengan khusyuk menurut keyakinan masing-masing. Izinkan saya akan memandunya secara agama Islam. Marilah bersama-sama kita menundukkan hati, memohon ampun, seraya mengharap agar doa kita dikabulkan oleh Allah Subhanahu wa Ta'ala. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yuafi ni'amahu wa yukafi mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhika wa 'azimi sultanik. Allahumma shalli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Ya Allah, ya Tuhan kami, segala puji serta syukur kami haturkan kehadirat-Mu atas segala rahmat dan karunia yang Engkau limpahkan, serta segala nikmat yang telah Engkau berikan kepada kami. Pada saat ini Engkau pertemukan kami dalam acara Kuliah Pakar Kebidanan STIKes Abdi Nusantara. Untuk itu ya Allah, ya Rahman, ya Rahim, jadikanlah acara ini acara yang Engkau ridhoi, Engkau rahmati, Engkau berikan taufik dan hidayah, sehingga acara ini berjalan dengan lancar dan membawa berkah serta manfaat bagi kami. Ya Allah, ya Rahman, ya Rahim, jadikanlah acara ini sebagai majelis ilmu yang akan bermanfaat buat kami semua, sekarang dan di masa yang akan datang. Jadikanlah ilmunya ilmu yang bermanfaat bagi kami, orang sekitar kami, masyarakat dan negara. Ya Allah, ya Qawiyyu, ya Matin, jadikanlah kami semua yang hadir di sini sebagai umat yang taat, umat yang manfaat, umat yang terus mengabdikan ilmu di jalan-Mu. Ya Allah, wahai Maha Pengampun dan Penolong, ampunilah dosa kami, dosa kedua orang tua kami, dosa guru-guru kami, dan dosa para pendahulu kami. Tolong dan bantulah kami untuk menjadi penerus yang amanah. Ya Allah, hanya kepadamu kami memohon, kiranya Engkau selalu membersamai setiap langkah kami ke depan. Rabbana zalamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana hab lana min azwajina wa dzurriyyatina qurrata a'yun waj'alna lil muttaqina imama. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for Mr. Asep. May the prayers can be answered by Allah Subhanahu wa Ta'ala. Amin. For the next agenda is reciting visi misi, will be led by Mrs. Ita Herawati, SST BD NKEP. For Mrs. Ita, time is yours.
Thank you, Alia. So, operator, please send the visi misi STIKes Abdi Nusantara. TV menjadi suami yang unggul dalam memfokuskan tenaga kesehatan berjiwa, leadership, dan entrepreneur berwawasan internasional pada tahun 2032. Dan misinya adalah menyelenggarakan dan mengembangkan pendidikan yang berjiwa, leadership, dan entrepreneur dalam pelayanan kesehatan, menyelenggarakan penelitian berbasis efek, menyelenggarakan pengabdian masyarakat yang berbasis evidence based practice yang berorientasi pada pemberdayaan masyarakat, menyelenggarakan dan mengembangkan kerjasama dalam menjaga kebijakan perguruan tinggi, menyelenggarakan tata kelola perguruan tinggi yang otonom, akuntabel dan transparan, yang menjamin peningkatan kualitas berkelanjutan. Yang keenam, menciptakan mahasiswa yang mampu mengeksplorasi dan menggunakan potensi mereka untuk menjadi intelektual yang beretika, berbudaya, berkompeten, dan dapat memasuki kinerja atau menciptakan lapangan kerja serta mengembangkan diri menjadi profesional. Visi misi program studi sarjana kebidanan dan pendidikan profesi bidan. Visi menghasilkan lulusan profesi bidan yang unggul dalam bidang pelayanan bidan keluarga, berjiwa leadership dan entrepreneur, serta berwawasan internasional tahun 2032. Visinya menyelenggarakan pendidikan profesi bidan berlandaskan moral etika dan unggul dalam bidang pelayanan bidan keluarga yang berjiwa leadership dan entrepreneur. Mengembangkan penelitian kebidanan yang inovatif dalam menunjang pelayanan bidan keluarga, mengembangkan pengabdian masyarakat dan menerapkan prinsip long life learning yang sensitif terhadap budaya masyarakat dalam bidang pelayanan bidan keluarga, menyelenggarakan kerjasama di tingkat nasional dan internasional yang menunjang kegiatan tri dan perguruan tinggi, menyelenggarakan tata pengembang perguruan tinggi yang otonom, akuntabel, dan transparan, yang menjamin peningkatan kualitas berkelanjutan, menciptakan mahasiswa yang mampu mengeksplorasi dan menggunakan potensi mereka untuk menjadi intelektual yang beretika, berbudaya, kompeten, dan dapat memasuki dunia kerja atau menciptakan lapangan pekerjaan, serta mengembangkan diri menjadi profesional. Selanjutnya adalah visi misi program studi D3 Kebidanan. Menjadi lulusan D3 Kebidanan yang unggul dalam bidang home care yang berjiwa leadership dan entrepreneur pada tahun 2027. Misinya menyelenggarakan dan mengembangkan pendidikan kebidanan di tingkat nasional yang unggul dalam bidang home care, menyelenggarakan penelitian kebidanan khususnya dalam bidang home care di tingkat nasional, mendharmabaktikan keahlian untuk meningkatkan derajat kesehatan melalui layanan home care dalam bidang kesehatan ibu dan anak, serta mengembangkan kerjasama tridharma dengan berbagai lembaga terkait yang menunjang kegiatan tridharma perguruan tinggi.
Thank you, Mrs. Sita. Now, I would like to invite leader of STIKes Abdi Nusantara, Mrs. Lia Idealistiana, SKM SSTBD Mars, to the opening speech for the international guest lecture today. Ms. Lia, time is yours.
Thank you, Miss Alia. Sorry, is my voice clear?
Yes, Bu Lia.
Okay, thank you. Okay, Bismillahirrahmanirrahim. Dear Chairperson of the Abdi Nusantara 2002 Foundation, Mrs. Dr. Mariati Sutarno, SPD, SSTBD Mars, MH. Seminar speaker, Dr. Kerry Hampton, RN, RM from Monash University, Melbourne, Australia. And moderator, Mrs. Melissa, PRM Clinic, whom I respect, Vice Chair for Academic and Student Affairs, STIKes Abdi Nusantara, Mrs. Rahayu Heria, SKM MK, Head of Midwifery Undergraduate Study Program, Mrs. Mariani MK BD, the Chief Executive for Expert Lecture Activity is also the Secretary of the Undergraduate Midwifery Study Program, Mrs. Ita Herawati, Head of the 3 Midwifery Diploma Student Program, Ibu Lili Falihatun MK, the entire academic community of STIKes Abdi Nusantara, the audience of happy expert lecture participants. Assalamualaikum warahmatullahi wabarakatuh. Good morning, greetings to all of us. For alhamdulillahilladzi hadana lihada wa ma kunna linahtadiya laula an hadanallah. Laqad ja'at rasulur rabbina bil haq wa na'udzu ankum jannatu uristumuha bima kuntum ta'malun. Asyhadu alla ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh wa ala alihi wa sahbihi amma ba'd. First of all, let us give thanks to the represent of Allah Subhanahu wa Ta'ala for the grace and a blessing of health that have been given to all of us so that today we can gather together for the international guest lecture event with the theme Optimizing Pregnancy Outcome by involving family in preconception and period of midwifery care. I would like to thank Ms. Carrie Hampton, your RM, who has accepted this virtual expert lecture invitation, and the head of the study program and his staff, and of course to the expert lecture participants who have participated. International expert lectures are a routine agenda that become a mandate. In the process of organizing education STIKes Abdi Nusantara, in effort to achieve vision and mission to able to produce graduates who excel at the international level. Therefore, we always provide full support for the holding of the event, and of course, this is also inspirable from the support of the Abdi Nusantara 2002 Foundation and the organizing body for the Abdi Nusantara STIKes education. On this occasion, I would like to thank Monash University, Melbourne, Australia, which is willing to collaborate in the academic field. Today's expert lecture takes the problem of stunting, which is a problem that is a national priority in Indonesia. Various prevention efforts are being optimized by various agencies in Indonesia. Stunting prevention can start before the pregnancy process occurs. This is in line with the goals of the Indonesian state in carrying out the program towards health Indonesian with a family approach, PES-PK, and achieving the vision of the STIKes Abdi Nusantara midwifery study program to produce midwifery student graduates who are competent in empowering families in midwifery services, who have a leadership and entrepreneurial spirit. Preparing a woman physically and psychologically from the time before conception will give the woman her organ and emotional readiness to carry out a pregnancy, so that women who are physically and psychologically prepared will have a positive impact on their health behavior. Attendees who are happy that the holding of this international expert lecture is a matter of pride for us, and I appreciate the effort of the head of the study program and his staff, lecturer and student to always strive to be creative and innovative to develop learning to achieve. Vision and mission excellent study program in family midwifery STIKes Abdi Nusantara, who has leadership and entrepreneurial spirit. The tenacity and persistence of the STIKes Abdi Nusantara lecture is, of course, in accordance with our motto, namely educating with a forefront heart in answering challenge. In education students to become creative and innovative human beings, so that in the end it can produce graduates who are intelligent, have strong character, have high and superior spirit intelligence. Finally, I thank you very much for this opportunity. Congratulations on attending today's expert lecture. If in blessing and mercy on all of us who are participants today, if in the process there are things that are not perfect, please forgive us, and may Allah bestow His blessing and mercy on all us who are participant in today. Amin ya rabbal alamin. Before I close, I will convey the pantun in Indonesia. Okay? Jalan-jalan ke kota Jakarta. Menikmati kota dengan kereta. Selamat mengikuti kuliah pakar di STIKes Abdi Nusantara. Semoga membawa keberkahan bagi kita semua. I end this speech by saying Alhamdulillahirabbil alamin, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you so much, Mrs. Leah, for the opening speech. Let's keep on the next agenda. Entering this core event, that is speech will be delivered by our guest lecturer, Dr. Kerry Hampton, RNRM, and will be guided by our moderator, Miss Melissa Putri, SSTM Clean. So without any further ado, please welcome Mr. Melissa.
Thank you, Miss Alia. The distinguished guest speaker from Monash University, Melbourne, Australia, Dr. Kerry Hampton, RN, RM, PhD. The Honorable Dr. Mariati Sutarno, SPD, SST, BD, Mars, MH, as the leader of Abdi Nusantara 2002 Foundation. The respectable Ibu Lia Idealistiana, SKM, SST, BD, Mars, as the leader of STIKes Abdi Nusantara. The Honorable our Head Study Program of Midwifery STIKes Abdi Nusantara, Ibu Mariani, SSIT, BD, MCUP, and Ibu Lili Farli Khatun, BD, MCUP. Our beloved students, fellow lecturers, midwives, and all the participants, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Good morning here in Indonesia and good afternoon to Dr. Kerry in Australia because it is 1 p.m. in Australia. So my name is Melissa Putri Rahmadena. I am a midwifery lecturer of STIKes Abdi Nusantara. Indeed, it is a great honor for me to be the moderator on this international guest lecture. So first of all, I would like to welcome you all on today's guest lecture entitled Optimizing Pregnancy Outcome by Involving Family in Preconception Period of the Midwifery Care. And especially to our special guest, Dr. Kerry Hampton, once again on behalf of our campus, STIKes Abdi Nusantara, we would like to give you our great appreciation. Thank you so much for your time to share your knowledge and experience regarding to our topics today. Indeed, we are very grateful and delighted to have you here with us. Although unfortunately we cannot meet directly, but hopefully in the near future, you could come here to Indonesia to visit our campus STIKes Abdi Nusantara. And now we are also live on YouTube, and I believe that there are hundreds of participants, midwives, and students are joining in this event. And before we get started to the main session, I need to let you know over a few items so you know how to participate to the discussion. This main session will be divided into 3 parts. First part is presentation session. Second is discussion. And the third is the official handover of e-certificate from STIKes Abdi Nusantara to the speaker. So the presentation session, Dr. Kerry will elaborate her material entitled Optimizing Pregnancy Outcome by Involving Family in Preconception Period of Midwifery Care for approximately 50 minutes. And in the discussion session, if you have any question, please just write them on the chat box or YouTube or a Zoom chat box. And you could also write your question in Bahasa Indonesia and I will translate into English. So it will be the discussion for the discussion session. And the last part, there will be an official handover the certificate to Dr. Kerry from STIKes Abdi Nusantara by Ibu Lia as the leader of STIKes Abdi Nusantara. So before we go on to the presentation, please kindly allow me to briefly introduce Dr. Kerry to you according to her biography. Slide CV, please, operator. Okay, thank you. Dr. Kerry, her full name is Kerry Hampton. She is an academic nurse and midwife. She holds a teaching position at 2 Australian University, Monash and Canberra University, and also a researcher in women's health. And her field of clinical expertise is fertility awareness and preconception care for informed reproductive decision-making, and better health outcomes for mothers, children, families, and communities. She also provides as a trainer for the training program titled Comprehensive Course in Natural Fertility Education, and also a frequently invited guest lecture on the topic. Her research interests include primary healthcare, women's health, fertility awareness, infertility, etc. And her educational background is from Monash University and Victoria University. And she also obtained the Best Thesis Award from Monash University at June 2015. What an experience. Okay, so before we go to the presentation session, technically you will be listening to the recorded lecture from Dr. Carey, and also I will try to translate some of the slide of the presentation. Jadi ibu-ibu semua, sebelumnya panitia sudah mengirimkan materi yang sudah kami translate. Jadi nanti sebetulnya secara teknis ibu-ibu akan mendengarkan materi yang telah direkam oleh Dr. Carey, sehingga nanti ibu-ibu bisa menyesuaikan slide yang sudah dikirim sebelumnya sesuai dengan apa yang akan saya tampilkan. Nah, nanti ketika ibu-ibu sudah punya pertanyaan, langsung saja boleh dituliskan ke dalam Zoom chat box ya, atau mungkin di YouTube ya. Kalau ada yang di YouTube, silahkan ditulis di kolom chat di situ. Nanti panitia akan membantu memilihkan pertanyaan-pertanyaan yang terbaik gitu ya, yang bisa kita jadikan bahan diskusi di sesi diskusi nanti. Jadi nanti Dr. Carey dalam rekamannya dia akan menjelaskan selama kurang lebih 50 menit, dan nanti sedikit mungkin ada beberapa slide yang belum ada penjelasan di dalam file translate-nya, nanti akan saya coba untuk saya jelaskan secara singkat begitu ya Ibu-ibu, supaya kita bisa meminimalisir kendala bahasa, supaya semua peserta bisa terlibat atau berkontribusi dalam kegiatan kuliah pakar ini. Okay.
Hello, my name is Dr. Carey Hampton, and I wish to thank Melissa, Ramadina, and STIKes Abdi Nusantara for inviting me to give this guest lecture. I am an academic nurse midwife. I hold teaching positions at 2 Australian universities and a researcher in women's health. My field of clinical expertise is fertility awareness and preconception care for informed decision-making and better health outcomes for mothers, children, families and communities. My PhD work has made important contributions to these fields, and I am a provider of the in-course health practitioner training program titled Comprehensive Course in Natural Fertility Education. I am also a frequently invited guest lecturer on this topic. My presentation is titled Nurse and Midwife Roles in Preconception Care. The questions that will be answered in this presentation are: what is preconception health and why is it important? Who should be targeted for preconception care? Where and how is preconception care delivered in Australia? What are the barriers people face in accessing preconception care? What are the nurse and midwife standards for practice that guide the delivery of preconception care? And in what roles and models of care do nurses and midwives contribute to preconception health care? So what is preconception health and why is it important? Interest in preconception health began in the late 1980s with the recognition that addressing the health of women and their partners prior to pregnancy is an essential element to achieve healthy outcomes for mothers and children. Preconception health refers to the health of people during their reproductive years, from menarche to menopause. all people can benefit from the principles of preconception health, as it is about people getting well and staying as healthy as possible across their lifespan. This approach to health confers many protective benefits to mothers and fathers and to children, whether they are planned or not planned.
Baik, saya akan menjelaskan sedikit. Jadi tadi seperti yang disampaikan di awal, Dr. Carey mengucapkan terima kasih telah diberikan kesempatan pada kuliah pakar ini, dan ada beberapa pertanyaan yang akan beliau sampaikan penjelasan dalam slide presentasinya, diantaranya mulai dari apa itu prakonsepsi, mengapa ini penting, kemudian siapa saja yang harus ditargetkan dalam pelayanan prakonsepsi, kemudian di mana dan bagaimana penjagaan atau pelayanan prakonsepsi itu diberikan di Australia, kemudian batasan atau kendala apa saja yang dihadapi oleh tenaga kesehatan dalam memberikan pelayanan prakonsepsi, kemudian apa yang jadi standar dari perawat dan juga bidan di sini dalam memberikan pelayanan prakonsepsi, kemudian apa peran yang bisa dilakukan oleh bidan dan juga perawat yang bisa memberikan kontribusinya dalam memberikan pendidikan kesehatan khususnya kepada keluarga, sehingga kita bisa melibatkan keluarga dalam pelayanan prakonsepsi ini. Dan tadi juga dijelaskan bahwa untuk kesehatan reproduksi ini dimulai dari tahun 1980 gitu ya, tentang adanya pengakuan bahwa wanita dan pasangan itu sebelum mereka hamil, ada hal yang paling penting harus dicapai bagi kedua pasangan tersebut gitu ya, untuk mencapai hasil kehamilan yang sehat, baik itu bagi ibu maupun bagi anak. Kemudian kesehatan prakonsepsi tersebut dimulai sejak dia masa reproduksi sehat, yaitu masa menarche, sampai dengan masa dia menopause gitu ya. Dan semua orang pasti akan mendapatkan manfaat dari kesehatan selama fase reproduksi tersebut gitu ya, dari masa dia menarche sampai dengan menopause. Ya, jadi ini sangat penting bahwa pendekatan ini harus dilakukan untuk mendapat manfaat untuk melindungi ibu dan juga ayah serta anak, supaya dia nanti menjadi kehamilan yang dengan outcome yang baik, seperti itu.
This infographic comes from the World Health Organization report titled Preconception Care. It lists the major risk factors affecting maternal and child health outcomes in countries from around the world, including in Australia. They are presented in relation to women and children, but most also impact the health of men and their offspring. The major risk factors are suboptimal nutritional conditions, which can include being underweight, overweight, or nutritionally deficient, vaccine-preventable diseases that can cause congenital abnormalities in children, such as rubella infection of women during pregnancy, genetic conditions that can be passed from mothers and fathers to their children, infertility and subfertility, which can be the result of unaddressed lifestyle risk factors such as sexually transmitted infection, being underweight, overweight, or smoking, female genital mutilation, too early, unwanted, rapid successive pregnancies, sexually transmitted infection, including HIV, syphilis, chlamydia, and gonorrhea, interpersonal violence, mental health, and substance use, such as tobacco and alcohol.
Jadi berikut ini adalah infografi yang berasal dari WHO mengenai pelayanan prakonsepsi. Di dalamnya tertulis mengenai faktor resiko utama yang mempengaruhi kesehatan ibu gitu ya, baik itu ibu maupun anak dan juga bayi di seluruh dunia, termasuk di Australia. Memang untuk faktor-faktor ini lebih banyak berhubungan dengan kesehatan wanita dan anak, tetapi banyak juga yang akan mempengaruhi kesehatan laki-laki dan juga anak gitu ya. Jadi faktor resiko utamanya kalau kita lihat di sini ada nutrisi yang tidak optimal. Mungkin kalau di Australia tadi dijelaskan bahwa lebih banyak terkait dengan obesitas gitu ya, tetapi mungkin kalau di kita lebih banyak dengan kek gitu ya. Tapi ini adalah keadaan yang sama-sama nutrisi yang tidak optimal gitu ya. Kemudian ada beberapa poin lagi, diantaranya ada penyakit yang dapat dicegah terkait dengan vaksin gitu ya. Kemudian selain itu juga adanya mutilasi genital wanita atau sunat wanita yang mungkin juga ada di daerah-daerah yang punya adat tersebut gitu ya. Kemudian jarak kehamilan yang terlalu dekat, kehamilan yang terlalu dini, kemudian IMS termasuk HIV, sifilis, klamidia, dan juga gonore gitu ya. Kemudian adanya kekerasan interpersonal, kemudian kesehatan mental, dan juga penggunaan substansi seperti rokok ataupun alkohol.
The prevalence of these different risk factors vary from country to country, and therefore so does their impact on the health of mothers and children. For example, in countries where the prevalence of a risk factor such as smoking, alcohol use, sexually transmitted infection, and interpersonal violence is higher, so too are the negative impacts on mothers and children's health. Importantly, these risk factors are potentially modifiable in preconception care. However, Australia, like many other countries, does not have a national guideline to optimise the implementation of preventive activities that would address the major risk factors for the optimal health of mothers and babies.
Jadi disampaikan di sini bahwa tadi secara singkat gitu ya, Australia pun sama seperti negara lain ya, belum punya petunjuk teknis nasional terkait dengan bagaimana mengoptimalkan implementasi aktivitas pencegahan atau kegiatan-kegiatan pencegahan yang dapat memecahkan masalah seperti faktor-faktor risiko utama tadi ya, untuk meningkatkan atau mengoptimalkan kesehatan ibu dan juga bayi.
For each of those major risk factors, the World Health Organization report presents a synthesis of the literature on the consequences of exposure for women and children. I will focus on a few of the main risks. These include tobacco use, alcohol use, too early, unintended and rapid successive pregnancies, and overweight and obesity. Regarding smoking, research has shown that whilst most men and women are aware of the risks of tobacco smoking and lung cancer, few understand the implications for fertility health, maternal health, and child health. This slide shows that smoking in the preconception period increases risk for infertility and conception delay. Smoking in the preconception period and in pregnancy increases risk for spontaneous abortion, ectopic pregnancy, placenta previa, placental abruption, and premature rupture of the membranes. It also increases risk for preterm birth, low birth weight, birth defects, and sudden infant death syndrome. Use of smokeless tobacco in the preconception period and in pregnancy also increases risk for stillbirth, preterm birth, and low birth weight. Exposure to second-hand smoking during the preconception period and in pregnancy also increases risk for low birth weight and birth defects.
Ya, sudah cukup jelas dalam slide ini. Jadi ditunjukkan ada beberapa resiko gitu ya pada merokok ya. Merokok saat di baris teratas, merokok pada saat masa prakonsepsi dapat menyebabkan infertilitas gitu ya. Kemudian di sini merokok pada saat selama kehamilan dan juga saat prekonsepsi period, ini efeknya ada preterm dan sebagainya sampai dengan kematian bayi ya secara mendadak. Kemudian penggunaan rokok tanpa tembakau ya pada saat prakonsepsi ini juga ada efeknya, adanya kematian janin sampai dengan preterm, BBLR, dan juga perokok pasif tentunya juga mendapat dampak yaitu BBLR dan juga kelainan kongenital.
Regarding alcohol use, alcohol is the most widely available legal psychoactive drug. Use among women of reproductive age in Australia has increased over the past several decades, and as such, it is a risk for women and children today in ways that it was not for women and children in past generations. Australian research has shown that around 56% of women had consumed alcohol while pregnant. This slide shows that alcohol use before conception increases risk for unintended pregnancy, risk for sexually transmitted infection, alcohol-related health conditions, and increased risk for interpersonal, social, legal, and financial problems, including violence and domestic abuse. The main risk for children from women consuming alcohol while pregnant is fetal alcohol spectrum disorder. Internationally, prevalent studies indicate that fetal alcohol spectrum disorder occurs between 1 and 5% of children. Data collection to indicate the prevalence of fetal alcohol spectrum disorder in Australia needs to be improved. Nonetheless, fetal alcohol spectrum disorder is a lifelong incurable disability with many consequences for the psychosocial health, education and employment of affected children and adults.
Ya, di sini juga cukup jelas dijelaskan mengenai penggunaan alkohol. Kalau di Australia, alkohol itu adalah penggunaan drug psikoaktif yang paling sering dikonsumsi, gitu ya. Dan ini efek-efek yang terjadi dan beberapa studi memang mempelajari efek dari penggunaan alkohol tersebut. Jadi ini cukup jelas ya dijelaskan di sini dari penggunaan alkohol sebelum masa konsepsi, kemudian penggunaan obat-obatan sebelum prakonsepsi itu dampaknya apa saja. Di sini sudah dijelaskan adanya juga dampak-dampak pada anak-anak dan juga wanita gitu ya. Salah satunya adalah gangguan kecerdasan spektrum alkohol ya yang cukup fatal terjadi, yang bisa terjadi sejak di dalam janin ya. Dan itu adalah gangguan kemampuan yang tidak bisa disembuhkan selama hidup ya, dengan banyak konsekuensi untuk kesehatan seperti psikososial, pendidikan dan juga pekerjaan anak-anak serta orang dewasa. Jadi cukup jelas dijelaskan di sini bahwa penggunaan alkohol pada saat masa prakonsepsi ini dapat mengganggu generasi selanjutnya gitu ya, menurunkan kualitas generasi selanjutnya.
Regarding maternal weight and fertility health, around 10 to 12% of Australian reproductive aged women are under healthy weight. That is a body mass index of less than 19. Being under healthy weight poses many risks for the health of mothers, pregnancies and babies. However, being over a healthy weight is a much bigger problem here in Australia. Around 67% of reproductive age women are over a healthy weight, being either overweight or obese with a BMI over 25. Being over a healthy weight increases risk of infertility and delayed conception. This slide shows that maternal overweight and obesity also increases risk for type 2 diabetes, hypertensive disease of pregnancy, gestational diabetes, hypertensive and thromboembolic disorders, postpartum hemorrhage and anemia, cesarean section delivery, induction of labour, instrumental birth and shoulder dystocia. And for children, it increases risk for birth defects, neural tube defects, preterm delivery, stillbirth and macrosomia.
Nah, mengenai berat ibu dan juga kesehatan fertilitas atau kesuburan ya, sekitar 10 sampai dengan 12% wanita pada usia reproduksi sehat di Australia itu punya IMT badan yang kurang dari 19 gitu ya. Dan juga masih banyak juga yang tentunya lebih banyak lagi gitu ya, 67% itu BMI-nya lebih dari 25. Jadi memang angka kejadian obesitas di Australia lebih tinggi gitu ya dibandingkan dengan yang under IMT gitu ya. Obesitas ini tentunya akan dapat meningkatkan resiko infertilitas ya, konsepsinya bisa terhambat gitu ya. Kemudian selain itu, slide ini juga menunjukkan bahwa berat dan juga obesitas maternal itu juga meningkatkan resiko diabetes tipe 2, kemudian penyakit hipertensi ya, diabetes gestasional, kemudian ada juga disorder thromboembolic hipertensi, kemudian perdarahan postpartum, anemia, SC, sampai dengan dystocia gitu ya. Kemudian bagi anak-anak sendiri dampaknya adalah meningkatkan resiko cacat lahir, cacat neural tube atau lahir preterm, kemudian IUFD dan juga macrosomia.
Pregnancies occurring too early in reproductive life are unintended, or there is too short a birth interval between pregnancies, contribute to increases in maternal and childhood morbidity and mortality. This table lists these increases in risks for mothers and babies, and as such highlights the importance of access to safe, effective and affordable family planning. Nurses and midwives in Australia in a variety of roles contribute to the provision of family planning services, as will be shown in some later slides.
Ya, kehamilan terjadi pada usia reproduksi yang terlalu dini gitu ya, yang tidak diinginkan, terlalu dekat. Kemudian ini juga memberikan kontribusi terhadap tingginya angka kematian dan kesakitan ibu dan anak di Australia. Dan tabel ini menunjukkan peningkatan risiko untuk ibu dan bayi, ya, menunjukkan pentingnya akses ke pelayanan kesehatan keluarga yang aman, efektif, gitu ya. Itu masih sangat diutamakan, ya. Dan bidan dan juga perawat di Australia punya peran yang cukup banyak, gitu ya, untuk bisa berkontribusi kepada keberhasilan keluarga berencana, seperti yang akan ditunjukkan pada slide-slide selanjutnya.
In all of my readings on preconception healthcare, this is the definition that I like most. And it is, good preconception healthcare empowers couples to reduce the risk of unplanned pregnancy and achieve the best possible outcomes for parents, children, and wider communities. The trick in clinical practice is to help couples to understand the connections and then mentor for change in positive, empowering, and self-esteem promoting ways.
Ya, disampaikan oleh Dr. Carey. Dr. Carey sangat tertarik dengan definisi ini, gitu ya, yang paling beliau selalu ingat, gitu ya. Pelayanan kesehatan prakonsepsi yang baik itu memungkinkan pasangan untuk bisa mengurangi resiko kehamilan pernikahan dan memperoleh keputusan yang terbaik untuk orang tua, anak, dan juga komunitas lebih luas, gitu ya. Upaya ini dilakukan di praktek klinik adalah untuk membantu pasangan tersebut untuk bisa memahami hubungan dan juga menentukan perubahan dengan cara yang positif, memperdayakan dan mempromosikan kepemimpinan diri sendiri. Jadi ini jelas-jelas sangat sejalan dengan visi STIKes Abdi Nusantara, tentunya juga yang sejalan juga dengan pemerintah, gitu ya, untuk bisa bersama-sama melibatkan keluarga, gitu ya, untuk meningkatkan tentunya meningkatkan outcome dari kehamilan untuk generasi yang lebih baik, gitu ya.
Understanding history always helps to understand the present. So in this lecture, I'm going to go back some decades to where preconception healthcare began. This document was published in America in 1989. It was the first of its kind and informs much of how preconception healthcare is practiced today in many countries around the world. It was published with the understanding that women with medical or psychological risk factors who were routinely monitored and managed throughout pregnancy and childbirth had better health outcomes. At the time, America was 17th in the world in infant mortality, while spending much higher proportions of their gross national product on healthcare than any other country. Other concerns were the disparities between black and white infant mortality, and low birth weights were roughly double in black children. These understandings and a desire for improvements in health outcomes for all mothers and babies led to the following recommendations: that preconception care be extended to include a range of biomedical and psychological preventive activities to improve women's health prior to, during and after pregnancy, and included the promotion of healthy child development, positive family relationships, and family planning. For the fetus and the infant, the objectives were to reduce preterm birth, intrauterine growth retardation, congenital abnormalities, and failure to thrive. To promote healthy growth and development, immunization and health supervision, to reduce neurological, developmental and other comorbidities, and to reduce child abuse and neglect, injuries, preventable acute and chronic illnesses, and the need for extended hospitalization after birth. For the family, during pregnancy and the first year of the infant's life, the objectives were to promote family development, positive parent-infant interaction, reduce unintended pregnancies, and identify for treatment behaviour disorders leading to child neglect and violence. With the original document came the recommendations that one prenatal care provider be in charge of and coordinate the team providing each woman's prenatal care, and that a comprehensive prenatal care record be used to facilitate continuous documentation of all risk assessment, health promotion and interventions, etc. And as risk assessment changes, the content of the prenatal care plan be amended accordingly. For many reasons, the ideals of these recommendations in general have not been realised. The World Health Organization has published a global consensus on preconception care, and a number of countries, including the Netherlands, the US and Italy, have national guidelines that support their implementation. However, as stated previously, Australia, like many other countries, does not have a preconception guideline, but it does have a comprehensive list of preventive activities for general practice listed in this book, locally known as the Red Book. Guidelines for preventive activities in general practice. In the absence of a guideline, most preconception care in general practice occurs opportunistically in the context of other health consultations. This approach has many limitations. Further, around half of general practitioners in one Australian study were unaware of the importance of the preventive activities listed in the Red Book or unaware of their importance.
Jadi WHO telah menerbitkan konsensus global gitu ya tentang pelayanan kesehatan masa prakonsepsi, dan beberapa negara ini termasuk Netherlands, US dan juga Italia punya peraturan nasional yang mendukung implementasinya gitu. Tapi seperti yang telah disampaikan oleh Dr. Carey sebelumnya, bahwa Australia seperti banyak negara yang lain juga itu belum memiliki peraturan khusus tentang prakonsepsi sendiri. Tapi sebetulnya mereka sudah punya list komprehensif atau upaya-upaya pencegahan secara komprehensif gitu ya. Dan upaya ini tertulis di dalam buku praktis yang besar ini, yang merah ini ya, dikenal sebagai petunjuk upaya pencegahan in general practice atau Red Book. Jadi dengan adanya guideline ini, banyak pelayanan prakonsepsi dalam praktek umum berlaku secara umum gitu ya, dalam konteks konsultasi kesehatan yang lain ya. Dan pendekatan ini punya banyak kelemahan ya. Selain itu, sekitar separuh dari dokter umum di Australia ya, ini dituliskan oleh salah satu studi di Australia, tidak tahu tentang upaya-upaya pencegahan yang ada di dalam buku merah ini. Jadi separuh lah ya, itu angka yang cukup tinggi gitu.
The WHO statement on preconception care is that sexual and reproductive health is fundamental for individuals, couples and families, as well as for the social and economic development for communities and nations. Everyone has the right to enjoy reproductive health, which is the basis for having healthy children, healthy reproductive life and happy families. I'll now discuss the definition and domains of preconception care. The definition of preconception care remains largely as it was in the original document. And that is, preconception care comprises counselling and the provision of biomedical, behavioural and social health interventions to optimise the health of women and their partners prior to pregnancy and to improve health-related outcomes for themselves and children. Here is a summary of the main preventive activities that aim to address the major risk factors to maternal and child health and to guide practice. It includes medical issues, screening, vaccination and lifestyle issues. I will highlight just a few of the main issues under each category. Medical issues involve asking if a woman has a reproductive plan or thinking about getting pregnant in the near future. A woman's response would indicate the content of the conversation that would follow. For women who are not planning a pregnancy but are at risk of getting pregnant, the issue of contraception would be raised. Around 25% of sexually active women in Australia are at risk of unintended pregnancy because of non-use of contraception. For women who are planning a pregnancy, other issues would be raised, such as medical conditions, medication use, genetic and family history, a physical examination such as a pap smear test, and breast examination. In Australia, around 5% of pregnant women take a medication of some kind, prescribed or over-the-counter, that is teratogenic and can cause congenital abnormality. And around 8% take medication for a condition such as hypertension, diabetes, and epilepsy, and may require specific management in the lead up to pregnancy and during pregnancy for the safety of the woman and the child. Blood screening is important. Blood type and antibody screening is conducted. Up to 10% of women have a negative blood group, which requires specific management for the health of current and future pregnancies. Screening and appropriate management of sexually transmitted diseases such as chlamydia, gonorrhea, syphilis, and HIV is important to reduce risk of infertility in the woman, congenital abnormality in the offspring, and perinatal transmission of HIV. Vaccinations involve screening for immunity, particularly for hepatitis B, rubella, and varicella. Being up to date with these vaccines before pregnancy can prevent some infections that may be contracted during pregnancy. Exposure to rubella during pregnancy can result in fetal infection, causing congenital rubella syndrome, which includes a range of serious birth defects such as intellectual disability, cataracts, deafness, and cardiac abnormalities. Women receiving viral vaccines such as measles, mumps and rubella and varicella should be advised against becoming pregnant within 28 days of the vaccination. Lifestyle issues include family planning, folic acid supplementation, healthy weight, nutrition, exercise, psychological health, substance use such as alcohol, smoking and illegal drugs, and healthy environment. Regarding family planning for conceiving, only 13% of women attending IVF services in Australia understood the time in the menstrual cycle when a woman could conceive. Around 9% of women smoked tobacco while pregnant. Around half of women had consumed alcohol during pregnancy. And while most had stopped when they found out they were pregnant, around 26% continued to drink once they knew they were pregnant. Around 67% of Australian adults are either overweight or obese, and the percentage of women who experience intimate partner violence depends on the type of violence, but remains a very significant issue. Women who take folic acid supplementation 1 month before pregnancy and for 3 months into pregnancy can reduce the risk of neural tube defect by up to 70%.
Jelaskan sedikit. Jadi ini adalah ringkasan dari kegiatan pencegahan ya, yang tadi untuk memecahkan risiko-risiko utama untuk kesehatan ibu dan anak serta memberikan petunjuk praktis. Ini juga termasuk ada isu-isu medis, kemudian ada screening, kemudian vaksinasi, dan juga isu lifestyle. Ya. Terkait dengan isu medis yang disampaikan di sini adalah wanita memiliki perencanaan atau berencana untuk hamil di masa depan, gitu ya, merencanakan kehamilan, ya, itu memberikan respon yang baik dalam pembicaraan yang diikuti, gitu ya. Bagi wanita yang tidak merencanakan kehamilan tetapi beresiko menjadi hamil, ya, Kemudian muncullah isu kontrasepsi di situ gitu ya, masalah-masalah kontrasepsi yang ditonjolkan di sini. Dan sekitar 25% wanita yang aktif berhubungan seksual di Australia ini beresiko terhadap terjadinya kehamilan yang tidak diinginkan karena tidak menggunakan kontrasepsi. Kemudian dijelaskan juga terkait dengan angka kejadian 5% wanita yang hamil itu masih mengkonsumsi obat-obatan seperti obat-obatan teratogenik gitu ya, yang dapat menyebabkan abnormalitas atau kelainan kongenital. Kemudian masih ada sekian persen, 8% yang mengkonsumsi obat karena kondisi hipertensi, diabetes, epilepsi gitu ya. Kemudian di sini disampaikan juga terkait dengan vaksinasi, melibatkan screening untuk imunitas ya, terutama untuk hepatitis B, rubella, dan juga varicella. Kemudian terkait dengan masalah kehidupan, termasuk masalah keluarga berencana, suplementasi asam folat, berat ideal, nutrisi, dan juga kesehatan psikologi. Kemudian di sini dikatakan bahwa wanita yang mengkonsumsi asam folat sebulan sebelum kehamilan dan selama 3 bulan selama kehamilan, di awal kehamilan, itu dapat mengurangi resiko kelainan neural tube ya, sampai dengan 70%.
Whilst general practice plays a critical role in the provision of preconception healthcare, there are many barriers to accessing the care in general practice. Barriers to the delivery of preconception care in general practice include the fact that significant proportions of pregnancies are unplanned or mistimed. In Australia and other similar countries, including England and America, up to 50% of pregnancies are unintended across women's reproductive lives, from their early teenage years through to menopause. Many people are unaware of the importance of the preconception health check before getting pregnant and therefore do not seek advice from their GP. Others falsely believe that the preconception health check relates only to women rather than to both men and women. Other limitations include barriers to accessing care among specific population groups. In Australia, these include Aboriginal and Torres Strait Islander people, people who live in rural and remote regions where health services are sparse or non-existent, refugees and other people from culturally and linguistically diverse communities, and people who are on low incomes or unemployed and cannot afford the cost of general practice appointments. Further barriers exist within the general practices. These include the time constraints among GPs, a lack of resources to provide the education and information, and a lack of awareness of the preventive activities in the Red Book or awareness of the importance of the preventive activities. In Australia, the nurse and midwife standards for practice both guide and govern expectations of practice. Several standards within these documents make explicit statements about the use of evidence in patient education, information and resources for informed decision-making for preventive healthcare for self, families and communities, and as such they relate to preconception care.
Jadi di slide ini dituliskan beberapa standar dalam dokumen ini membuat pernyataan secara eksplisit tentang penggunaan bukti atau evidence dalam pendidikan, informasi, dan juga sumber daya untuk membuat keputusan yang informatif untuk bisa menjaga kesehatan dan juga mencegah atau melakukan kegiatan pencegahan untuk dirinya sendiri, keluarga, dan juga komunitas, dan sebagainya. Mereka dapat juga dalam kegiatan-kegiatan yang terkait dengan pelayanan prakonsepsi. Kalau di kita mungkin secara singkat adalah pemberdayaan dirinya gitu ya, pemberdayaan keluarga, baik individu dan juga keluarga.
For prenatal care to be effective, it must be available and it must be used. This statement comes from Peter Bernstein, an American medical doctor and public health advocate who has been a long-standing advocate for healthy pregnancy. His statements are consistent with those of the WHO Preconception Care Report, and in essence he believes that people must know about preconception health and why it is important, and it must be made widely accessible to both men and women. To increase preconception health and uptake of preconception care, he states that a consciousness raising of its importance is required among healthcare professionals and community alike. Bernstein states that every healthcare provider who takes care of a woman of reproductive age has something to contribute to preconception care. He believes that Ask Every Woman should be the mantra of preconception care. That is, every woman of reproductive age should be asked whether she intends to become pregnant in the next year. He also states that if you wait for her to say, "I'm planning on getting pregnant," you're going to miss about 50% of pregnancies in some countries. Bernstein believes that every healthcare provider, whether they are nurses, midwives, general practitioners, specialists or pharmacists, who takes care of women of reproductive age has something to contribute. He then provides several excellent examples of taking this opportunistic approach. The first example is a rheumatologist taking care of a woman with lupus. He should tell her that her best chance of a healthy pregnancy is when the lupus has been in remission for at least 6 months before pregnancy. And for a woman considering a pregnancy, the clinician should prescribe medications that are least teratogenic for her baby. The second example is that morbidly obese women are often anovulatory, and so they think that they are infertile and therefore don't use contraception. A bariatric surgeon taking care of morbidly obese women should advise women that losing a significant amount of weight after surgery may start them ovulating. Many women have unintended pregnancies in this situation because no one had advised them about the need for contraception after surgery. This infographic highlights Bernstein's point. It shows that the mean entry into care is around 11 weeks of pregnancy and that early prenatal care can be too late. By the time a pregnant woman makes it to her first prenatal visit, most fetal organs have already been formed, and many interventions to prevent birth defects and other adverse maternal and child outcomes may be too late to have the desired effect. You can see on this slide that by 11 weeks, the central nervous system, the heart, the arms, the eyes, the legs, the teeth, the palate, and the external genitalia and ears have already been developed.
Jadi kalau untuk infografi ini menunjukkan tadi yang dijelaskan oleh Bernstein, ini menunjukkan bahwa kunjungan atau pengambilan utama ke dalam prakonsepsi sekitar 11 minggu ketika kehamilan, jadi kunjungan awal kehamilan di 11 minggu, dan juga ANC dini ini juga bisa dikatakan cukup terlambat juga gitu ya. Saat perempuan datang pada saat kunjungan pertama ANC, kebanyakan organ fetal itu sudah terbentuk ya. Dan kaitannya tadi intervensi untuk mencegah kelainan gitu ya, kemudian keputusan-keputusan yang seharusnya diambil secara lebih dini untuk bisa memperoleh efektivitas dari pencegahan kecacatan atau ketidaknormalan tadi itu bisa dikatakan cukup terlambat ya jika dilakukan pada saat 11 minggu, karena dalam grafik ini dijelaskan bahwa dalam 11 minggu itu sudah terbentuk seperti sistem saraf pusat, kemudian hati, tangan, mata, kaki, genitalia luar, telinga itu juga sudah terbentuk gitu ya. Jadi kalau 11 minggu dia melakukan kunjungan awal, disimpulkan itu sudah cukup terlambat juga gitu.
To optimize the preconception health for the best outcomes for mothers and babies, the World Health Organization and many other organizations and people advocate for preconception health across reproductive life, beginning in adolescence and through to menopause, and that a whole-of-system approach is needed to achieve this. This means recognising the multiple roles and contributions of a range of healthcare providers in both primary and tertiary settings, and in intersectorial collaboration with organisations outside the healthcare sector, such as primary and secondary schools. Importantly, the same lifestyles, educational strategies that promote general health, promote the health for mothers and children, reduce risk for chronic diseases, disability, and premature death in adults. Nurse and midwife roles and models of care in preconception healthcare. Considering a whole-of-system life course approach to preconception health, nurses and midwives are already making a substantial contribution in many fields in the primary and secondary care sectors. And research in Australia and other countries aim to expand their scope of practice and to formalise their roles in this field. This slide presents many of the diverse fields of practice in Australia in which nurses and midwives contribute to the preconception health of men and women. This list is by no means exhaustive, and many of the roles are linked to one or more of the major risk factors that affect maternal and child health, as listed in the WHO document. I'll expand on just a few of them, those highlighted in blue: diabetes educator, maternal and child health nursing, practice nursing, refugee nursing, school health nursing, and sexual and reproductive health nursing. Diabetes educator, role overview and contribution to family health. Historically, nurses have filled this role, but more recently, midwives can also become credentialed as a diabetes educator. Today in Australia, around 17% of women who give birth are diagnosed with gestational diabetes in their pregnancy. Diabetes has become an increasing problem with the trend towards later childbearing, higher rates of overweight and obesity. Around 67% of reproductive age women in Australia are now overweight or obese, and a growing proportion of higher risk groups in the population, such as those from Africa and India. Diabetes educators support self-management for optimal well-being. They provide support and advice to people with diabetes who are planning a pregnancy, are pregnant, or who have recently been pregnant. They collaborate with other healthcare providers to ensure optimal all-round care. And all of this is essential to reduce risks in children for birth defects, being born prematurely, or even stillborn, and in mothers to reduce such risks such as preeclampsia. Refugee nursing, role overview and contribution to family health. The number of refugee and humanitarian entrants welcomed to Australia since World War II is edging towards 1 million. Given that Australia's population is around 25 million, that's a significant proportion of the overall population. Refugees and people from culturally and linguistically diverse communities typically face many barriers to accessing care in mainstream health services in their host country. In Australia, nurses and midwives practicing refugee health are found in all states and territories. They make a significant contribution to family health by increasing people's access to affordable and culturally safe care. This includes access to family planning and pregnancy support services, safe sex information, sexually transmitted infection screening and treatment, cervical and breast cancer screening, screening and vaccinations for preventable diseases such as measles, mumps and rubella, and they collaborate with other services to optimise service delivery.
terkait refugee nursing. Jadi kalau di Australia kan cukup banyak juga ya jumlah refugee atau kita menyebutnya mungkin pengungsi ya yang datang ke Australia sejak Perang Dunia II. Tadi dijelaskan ada sekitar 1 juta gitu ya, disebabkan populasi Australia saat ini kan mungkin sekitar 25 juta ya, dan itu 1 juta itu adalah proporsi yang cukup tinggi juga jika dibandingkan dengan populasi seluruhnya. Dan untuk refugee dan juga orang-orang dari komunitas yang lain seperti suku-suku aborigin yang ada di Australia, itu ada hambatan-hambatan dalam mengakses pelayanan kesehatan yang utama gitu ya. Mungkin kalau di kita masalah-masalahnya mirip dengan daerah-daerah yang mungkin susah mengakses ke fasilitas kesehatan gitu ya. Kemudian di Australia juga, di sini bidan dan juga perawat itu diberikan kesempatan pelatihan terkait dengan kesehatan refugee atau kesehatan pengungsi tadi, yang tentunya itu diadakan di seluruh negara di Australia. Dan mereka punya kontribusi yang sangat signifikan dalam kesehatan keluarga ya, untuk meningkatkan akses orang-orang tersebut, akses para refugee tersebut kepada pelayanan yang murah, yang berkualitas dan juga aman.
Sexual and reproductive health, role overview and contribution to family health. Both nurses and midwives are involved in sexual and reproductive health in Australia. They contribute to family health through the provision of a range of sexual and reproductive health services. This includes the provision of health promotion and outreach services in sexual and reproductive health to schools, refugees, and culturally and linguistically diverse communities. They provide a range of education and clinical services in family planning. They promote safe sex practices, screening for sexually transmitted infection, cervical screening, and breast screening for cancer, vaccinations against preventable diseases, and counselling and referral for unintended pregnancy. Maternal and child health nurse, role overview and contribution to family health. In Australia, a maternal and child health nurse is a registered nurse and also a registered midwife with an additional qualification in maternal and child health. They work in partnership with families to care for babies and young children until they start school. They provide support and advice on a variety of topics, including parenting, development and learning, child health, family health and well-being, safety, immunisation, breastfeeding, nutrition and family planning. They also support the delivery of services that are welcoming and respectful and safe, and strengthen the self-determination of Aboriginal organisations. School nursing, role overview and contribution to family health. A school nurse in Australia can be a registered nurse or a registered nurse and midwife. They contribute to family health by improving access to information and resources that reduce risk for early, unprotected or forced sexual intercourse. They promote safe sex and condom use to reduce risk for sexually transmitted infection and unintended pregnancy. They provide teenage pregnancy support, and they collaborate with schools and other support services as needed. Those are just a few of the roles in which nurses and midwives in Australia contribute to family health. I'll now present some Australian studies that have explored the possibility of expanding the roles of nurses and midwives in preconception health in general practice. I'll focus on my studies, but acknowledge that several other studies have followed with similar findings.
Jadi tadi sudah kita lihat penjelasan dari beberapa peran-peran perawat dan juga bidan di Australia untuk mengambil atau memiliki kontribusi dalam kesehatan keluarga gitu ya. Di sini Dr. Carey akan menjelaskan secara lebih lanjut terkait dari beberapa hasil penelitian di Australia yang telah meneliti perkembangan peran perawat dan bidan dalam kesehatan prakonsepsi dalam praktek umum gitu ya. Dan beliau akan fokus pada studi beliau yang tentunya berkaitan dengan prakonsepsi yang juga penelitian-penelitian lain yang penemuannya mirip gitu ya.
This graph comes from my doctoral work, As a nurse, midwife in clinical practice teaching couples fertility awareness to conceive, I often wondered what percentage of women who were receiving IVF treatment understood the fertile window of the menstrual cycle to optimize natural conception. In the surveys with women, I found that only 13% who had attended an ART clinic, so an assisted reproductive technology clinic, otherwise known as IVF clinics, and only 2% who attend general practice were able to accurately identify the fertile window of the menstrual cycle. High fertility awareness was when women understood either the mucus or the temperature methods of fertility awareness and had used them for at least 3 menstrual cycles, so they had put them into practice. This finding suggests that couples who attend IVF clinics may not have optimized the chance of natural conception before resorting to the treatment. Australia has one of the most supportive healthcare environments in the world for the use of IVF treatment, but it does not have a guideline for the prevention of infertility in primary care that addresses fertility awareness, which is an aspect of preconception care. IVF is expensive, associated with health inequities and increases in adverse outcomes for mothers and babies. The latest figure in Australia is that 4.9% of all births are the result of IVF treatment.
Grafik ini dari hasil penelitian doktoral Dr. Carey sebagai bidan dan juga perawat dalam praktek klinis yang mengajar tentang kesadaran pasangan terkait fertility gitu ya. Beliau mengangkat masalah berapa persentase perempuan yang menerima IVF ya, mengerti tentang masa subur untuk bisa mengoptimalkan konsepsi yang alami gitu ya. Dalam surveinya beberapa wanita diperoleh ya hanya 13% yang hadir ke kelas disebutnya klinik seni atau klinik teknologi reproduktif yang dikenal sebagai kelas atau klinik IVF, dan hanya 2% yang menghadiri latihan umumnya untuk mengidentifikasi tadi masa subur gitu ya, dan juga jendela subur dari siklus menstruasi. Jadi pemahaman wanita terkait dengan masa subur ini bisa dikatakan cukup rendah gitu ya, sehingga dia tidak bisa mempraktekkan atau menggunakan masa subur ini untuk bisa mencapai konsepsi yang natural gitu ya, yang alami. Dan dikatakan di sini bahwa IVF itu sebenarnya tindakan yang cukup mahal gitu ya, terkait dengan kesehatannya pun untuk outcome kesehatan ibu dan bayinya pun juga butuh biaya yang sangat tinggi ya. Dikatakan di sini 5% dari anak-anak yang lahir di Australia itu adalah hasil tindakan dari IVF.
Among women attending IVF or ART clinics and general practices, and nurses and midwives and doctors in general practices, they either agreed or strongly agreed that correctly timed intercourse may help some infertile couples to conceive, and that women should receive this type of education when first reporting in general practice that they were having trouble conceiving.
Jadi kalau grafik ini bahwa semua praktisi umum ya, baik itu perawat, bidan dan juga dokter gitu ya, mereka setuju atau sangat setuju bahwa pendidikan terkait dengan masa subur, kemudian terkait berhubungan seksual pada masa subur yang baik ini sangat penting diberikan kepada pasangan yang sedang dalam masa prakonsepsi gitu ya, ketika dia pertama kali mengunjungi tempat praktek ya, sehingga itu dapat meminimalisir terjadinya masalah konsepsi.
Further, when general practitioners and practice nurses were asked who should deliver fertility awareness education in general practice, nearly 80% nominated the practice nurses and midwives, as the most preferred practitioner group to deliver the education for women. Far fewer nominated the general practitioner, and fewer still believed that the education should occur in IVF clinics.
Nah, kalau untuk grafik ini ditunjukkan bahwa tenaga kesehatan yang paling punya angka paling tinggi dalam polling gitu ya, yang seharusnya menyampaikan edukasi terkait kesadaran fertility atau kesadaran fertilitas itu hampir 80% itu menominasi perawat dan juga perawat bidan sebagai tenaga kesehatan yang terpilih untuk bisa memberikan edukasi kepada wanita dan juga keluarganya terkait dengan kesehatan reproduksi yang dimulai sejak masa prakonsepsi. Kemudian lebih sedikit lagi menominasi praktisi general ya atau dokter umum gitu ya, dan yang lebih sedikit lagi adalah masih ada beberapa orang yang berpandangan bahwa terkait dengan edukasi ini seharusnya diadakan di klinik IVF gitu ya. Jadi memang yang paling tinggi di sini adalah perawat dan juga perawat bidan itu seharusnya memberikan edukasi terkait kesehatan pada masa prakonsepsi.
As I have said, fertility awareness is an aspect of preconception care. The main barriers to the delivery of this type of education in general practice were a lack of skills and resources, which included a lack of time, educational materials and remuneration for the practice nurse, medical dominance, which included IVF clinics promoting their services in general practice, and the personal nature of the topic. The main enablers of this type of education were practice nurses, nurses and midwives being trained in fertility awareness and working in collaborative team care arrangements with GPs.
Jadi seperti disampaikan tadi bahwa kesadaran kesehatan kesuburan itu adalah aspek yang utama dari pelayanan prakonsepsi. Masalah utama yang sering dihadapi adalah ketika menyampaikan edukasi di tempat praktek gitu ya, yang menjadi kendalanya itu adalah kekurangan atau kurangnya ekspertis dari sumber daya yang ada dari petugas kesehatan tersebut atau pengetahuan dari tenaga kesehatan tersebut gitu ya. Kemudian juga termasuk kurangnya waktu, kemudian kurangnya materi edukasi, kemudian kurangnya kompensasi untuk perawat dan juga bidan gitu ya. Kemudian yang termasuk dalam klinik IVF yang mempromosikan pelayanan prakonsepsi ini dan juga pandangan pribadi terhadap kesadaran kesehatan prakonsepsi ini. Nah, penyumbang utama edukasi terkait dengan pelayanan prakonsepsi adalah perawat dan juga perawat bidan yang sudah mendapatkan pelatihan tentang fertility awareness dan juga berkolaborasi dengan dokter umum.
In recent years, greater research attention has turned to how to optimize the preconception health of men through health promotion and in general practice. General practice workforce comprises general practitioners, nurses and midwives. The main barriers to this care in general practice include that most GPs raise the issue with men only occasionally. 90% of general practitioners lack confidence in their knowledge about modifiable factors that affect male fertility, and the sensitivity of the subject and fertility being perceived as a female issue. The main facilitators include training and education, trustworthy websites, and fact sheets.
Jadi di tahun terakhir itu perhatian peneliti itu lebih besar pada bagaimana mempromosikan kesehatan prakonsepsi ini untuk lelaki, dalam hal ini konteks keluarga gitu ya, pasangan, melalui promosi kesehatan dan dalam praktek umum ya. Praktisi umum atau dokter umum, kemudian perawat, bidan ya, dalam kendalanya dalam pelayanan ini adalah dikatakan bahwa beberapa dokter umum itu mengangkat masalah kesehatan laki-laki itu hanya sedikit. Jadi 90% dari praktisi umum atau dokter umum ini kurang yakin dengan pengetahuan mereka sendiri tentang beberapa hal atau faktor-faktor yang mempengaruhi kesehatan fertilitas laki-laki. Jadi mereka sendiri tidak yakin gitu ya, dan itu menjadi kendala ketika menyampaikan edukasi. Kemudian sensitivitas subjek dan juga fertility yang dianggap sebagai masalah wanita saja, bukan masalah pria gitu ya. Kemudian selain itu juga terkait dengan fasilitator, ini termasuk pelatihan-pelatihan ya, website-website dan juga pernyataan-pernyataan yang dapat dipercaya itu masih menjadi kendala.
In summary, preconception care is a relatively new and emerging field of research and practice, with increasing interest and recognition around the world of its importance for better health outcomes for all. Through a range of preventive activities, preconception care can reduce risk for unintended pregnancy, optimize the health of parents, babies, families, and communities. There is increasing evidence that the involvement of men also confers health benefits, both for themselves and their offspring. A whole-of-system approach across the life's course would improve access, especially among vulnerable population groups. Nurses and midwives contribute to men's and women's preconception health in a range of fields across the primary and tertiary health sectors. And new models of care are being explored to expand the roles of nurses and midwives in this field to increase people's access. Thank you for listening.
Okay. So, thank you, Dr. Carey, for your presentation regarding to the topic. That is a very clear elaboration, yet of course we are eager to have further discussion with you. I have also highlighted several things to be discussed further. Now we come to the discussion part. So let me check real quick here. Panitia mungkin bisa dibantu beberapa pertanyaan sebentar. Hello, Dr. Carey. Could you please unmute? You're still on mute mode. Yep, still mute, Carey.
Is that better?
Yeah.
Yeah, okay. Yeah. Thank you very much. Thank you for inviting me and being able to present on this topic.
Yeah, and I'm very interested on your statement on the recorded material that you told us that this is very important to have a preconception period before you get pregnant, right?
I do.
Yeah. By saying that, I just wonder if is there any specific encouragement from the health provider like nurse or midwives to involve the family or involve the man itself. In this context is man as a family of the woman to be more involved in the preconception health. What do you think about that?
Yes, that is happening. If you look back in history, it's mainly been women who have been the focus of preconception care.
Correct.
But as research has occurred over the years, we've become increasingly aware of how important it is to involve men, and practitioners generally do invite men to come along and to participate. But I think still it's primarily women who do participate. So it's about encouraging men to participate and helping men understand the importance of participating through health promotion programs, etc. And so we are seeing improvements in this area, but I think we've got a long way to go.
Okay, thank you, Dr. Carey. So tadi dijelaskan oleh Dr. Carey bahwa langkah spesifik terkait dengan meningkatkan, memberdayakan keluarga atau memberdayakan laki-laki dalam hal ini ya, memang dalam sampai dengan saat ini masih lebih rendah dibandingkan dengan yang memandang bahwa prakonsepsi itu adalah kepentingan kesehatan wanita gitu ya. Tetapi kita bisa melihat peningkatannya karena banyak penelitian-penelitian yang mengkaji tentang keterlibatan keluarga dalam pelayanan prakonsepsi gitu ya. Dan ini tentunya juga sejalan dengan visi misi STIKes Abdi Nusantara gitu ya, yang kita supaya lulusannya lebih kompeten lagi dalam memberdayakan keluarga, dalam hal ini adalah pelayanan prakonsepsi. Dan langkah spesifik yang bisa dibantu yang disampaikan oleh Dr. Carey tadi adalah dengan misalnya memberikan edukasi juga kepada si pria tersebut atau pasangan ya, keluarga, untuk mengerti lebih dalam, lebih lanjut tentang kesehatan prakonsepsi itu sendiri. Okay, I'm still waiting for the question here, Dr. Carey. Let me check real quick for the questions. Okay. There's a lot of questions on the chat box, I think. Oh, wait a minute, where is my chat? Okay, here we go. Mohon sharing kebijakan dan cara meningkatkan keaktifan masyarakat, khususnya perempuan, dalam meningkatkan peran untuk melakukan konseling prakonsepsi, karena di Indonesia masih dianggap tabu. Okay, so Dr. Carey, there's still many problems in Indonesia regarding to the preconception health. Some people, most of people still think that this is shameful to ask about it, to ask about the preconception, right? And could you please tell us or explain us further about how we can encourage the people, especially the communities, to be more aware about their health, especially the health of the women in their preconception, because most of them, they are ashamed to ask. They are still maybe afraid to ask about their own health. So what do you think about that?
I think that's an excellent question, and thank you for asking. And it's a question I've pondered for quite some time. And I really, really, really like the idea of incorporating general healthcare, preconception healthcare across the right lifespan, from early teenage years right through to menopause. So if you have, for instance, school nurses talking about the health impacts of smoking, alcohol, unintended pregnancy, I think it can be delivered in general to schools, the community, without necessarily people having to go along and specifically ask for the information. So it becomes part of their general education. But of course, at the end, when women are planning on having a pregnancy, it's still important to consult nurses and doctors to make sure that all of the aspects of preconception care are ticked off. But if you approach preconception care right from school, hopefully that will mitigate some of that reluctance and embarrassment, just prior to pregnancy.
Nice. Okay. Ya, jadi dijelaskan oleh Dr. Carey bahwa pendekatan memberikan pendidikan pada saat pendidikan di awal gitu ya, bahkan saat remaja ya, mungkin pada saat SMA ataupun SMP gitu ya, sejak dini memberikan edukasi terkait prakonsepsi ini sejak dini, itu akan dapat meminimalisir masalah tadi bahwa prakonsepsi masih dianggap tabu gitu ya. Jadi kalau misalnya kita sebagai bidan yang sudah mengantongi ilmu ya sejak kita kuliah di baik itu di diploma, S1, profesi gitu ya, ketika kita memberikan edukasi kepada masyarakat, tentunya kalau mungkin kita lebih banyak kepada individu yang sudah remaja akhir atau mungkin kepada yang sudah pasangan gitu ya, yang menjelang pernikahan gitu ya, prakonsepsi, kemudian kehamilan gitu ya. Tetapi kalau untuk yang pendidikan yang bisa dilakukan di sekolah, kemudian di sekolah-sekolah itu mungkin bisa dibantu pada saat ketika kita dosen-dosen bidan mengajarkan kepada mahasiswa di STIKes gitu ya, di mahasiswa di STIKes, kemudian diajaklah mahasiswa STIKes itu mungkin kalau di kita adalah seperti ini ya, komunitas ya, praktek komunitas ya, itu kita juga bisa melibatkan sekolah-sekolah gitu ya untuk bisa mendapatkan edukasi terkait prakonsepsi. Nah, ini dapat meminimalisir tadi masalah bahwa prakonsepsi itu adalah hal yang tabu. Semoga hal ini cukup menjawab ya, Bu siapa ini ya?
And if I could add to that,
Okay.
Melissa.
Yes.
And if I could add to that, if you take that long-term approach, beginning in school health nursing, primary care, you actually capture men as well. You help
I see.
You help to
It's
help
not
them.
only women, it's not only the girl, yeah.
That's right.
Ya, jadi kalau kita memang memberikan edukasi prakonsepsi itu sejak awal, nah itu tidak spesifik pada wanita saja gitu ya. Jadi itu juga bisa meminimalisir bahwa tadi masalah prakonsepsi itu hanya masalah wanita saja. Jadi sejak dini, edukasi yang sejak dini terkait dengan prakonsepsi bisa dimulai sejak masa sekolah dan itu juga bisa langsung melibatkan pria dan juga wanita ya, jadi secara keseluruhan, jadi tidak hanya wanita saja, karena masalah yang ada saat ini kan hanya wanita saja, bahwa prakonsepsi itu hanya masalah wanita saja. Semoga itu bisa menjawab ya Bu Ita. Kemudian, thank you very much Dr. Kerry for the answer for the first question. We still got many questions.
Okay.
Okay, so the second question, bagaimana keterlibatan keluarga yang dilakukan oleh tenaga kesehatan di Australia terhadap pemberian asuhan prakonsepsi? Bagaimana keterlibatan keluarga yang dilakukan oleh tenaga kesehatan? Tadi mungkin sudah dijawab di awal ya, terkait dengan bagaimana melibatkan keluarga itu diikutkan sejak tadi ya diberikan pengertian terkait lebih baik prakonsepsi sendiri, pengertian lebih lanjut terkait prakonsepsi pada pria gitu ya sebagai pasangan atau sebagai keluarga. Seberapa pengaruhnya suami perokok berat pada tingkat kesuburan pasutri? Karena banyak kasus keguguran dengan suami perokok berat. Upaya yang dilakukan nakes. Oke. Dr. Kerry, we are talking about the use of tobacco.
The use of,
smoking.
sorry?
The tobacco smoking.
Smoking.
Yeah, smoking. So there's a question about how impactful the passively tobacco smoking, the passive tobacco smoking for the health of the fertility of that couple. That's the first question. Because there are so many that you have also explained that smoking during the pregnancy, it can cause to the preterm birth, and also it can cause the low birth weight, right?
Yeah.
So is there any specific encouragement from the health provider to, how to say, to stop? It's not as easy as to stop someone to stop smoking, right? But is there any, any special encouragement that we can do as a health provider to promote the more healthy life without smoking, I mean?
Yes. Well, in Australia, we have several organisations, one of them being the Anti-Cancer Council, and several organisations, including the Anti-Cancer Council, have tools to help people quit smoking that nurses and midwives and GPs can download and then engage with people to help them understand the health effects of smoking and then strategies for quitting.
Okay, so the tools is like some points that we can address to the people who is smoking.
Yep.
Okay.
Yep.
Jadi ya sebenarnya di Australia itu ada beberapa organisasi yang sudah mengembangkan tools gitu ya, atau beberapa mungkin di sini kaitannya seperti instrumen ya, dan juga mungkin isinya ada beberapa poin yang itu juga bisa di-download oleh bidan dan juga perawat dan juga praktisi yang lain untuk bisa membantu orang untuk yang mau berhenti merokok gitu ya. Karena memang itu bukan suatu hal yang mudah ya untuk bisa mencegah seseorang memberhentikan seseorang merokok gitu ya. Tapi di sini memang tadi sudah dijelaskan juga di dalam slide bahwa perokok baik itu perokok aktif maupun perokok pasif itu memiliki dampak yang sangat signifikan terhadap kesehatan ataupun kesuburan pasangan tersebut. Begitu ya Bu Farida Ubaya. Jadi tadi memang ada beberapa instrumen, di situ ada beberapa list poin-poin yang disampaikan oleh Dr. Carey, itu memberikan pengertian terkait dengan kesehatan yang ataupun kondisi yang bisa didapatkan oleh orang yang merokok gitu ya. Jadi itu instrumen bisa dipakai untuk membantu seseorang tersebut bisa berhenti merokok. Tapi itu memang butuh waktu yang cukup lama gitu ya. Izin bertanya, semoga itu menjawab ya Bu Farida Ubaya. Karena masih banyak masyarakat tidak percaya rokok untuk mempengaruhi kesuburan. Oke, izin bertanya seberapa pengaruh tadi sudah. Mohon izin sharing untuk tips and trik menjadi wanita yang sehat, reproduksi, dan juga gizi seimbang. Di Indonesia masih sulit mendapatkan reproduksi midwifery care, reproduksi secara perkara dan rutin wanita oleh wanita. Bagaimana caranya agar wanita mendapatkan hak reproduksi? Oke. So there's a question about the right of health reproductive in women in Indonesia. So is there any special recommendation from you, Dr. Carey, to women in Indonesia how to improve the health reproductive with the optimum nutritional? Because we know that there's so many problems regarding to the nutritional, like obesity. But in Indonesia, the number of underweight or the body under the BMI is more than the number of the obesity. But I know, yeah, it's the same. It's the same. It's the, how to say, the nutrition, the not optimal nutrition, right? Yeah. So is there any special recommendation from you how to improve the health reproductive, especially in the nutrition, how to optimize the nutritional for the women?
Gosh, I think that's a really, really big question and could have many, many answers depending on a woman's circumstance. And it would come down to access to healthy food, affordability of healthy food,
right.
Her personal circumstances in terms of, you know, how many hours worked or, you know, in relation to eating, etc. So I'm not sure that I have a specific answer for women in Indonesia, but I can give you an example as to how I approach it here in Australia. Would you like me to do that?
Yeah, of course. Yeah.
Okay. Yeah. So, well, first of all, I was aware that being underweight is a bigger issue for yourselves in your country than it is here in Australia. But as I said in the lecture, between 10 and 12% of people in Australia are underweight, reproductive age women. And the way that I actually educate women about this is to get them to chart their menstrual cycle. And when they chart their menstrual cycle, they can see that when a woman is underweight, it actually causes the cycle to become often, not always, but often non-fertile. So it's a late ovulation, short luteal phase, non-fertile. And when you explain that to women and they start then perhaps eating breakfast or eating more regularly across the day, what happens is that ovulation occurs more early in the cycle. The luteal phase is sufficient, and then they go on to conceiving. So that's something I do on a fairly regular basis in practice, teaching women about how weight, either underweight or overweight, actually impacts fertility. And it's the same.
Okay.
Being underweight and overweight has the same impact. Yeah. So.
Okay. Yeah. Jadi dijelaskan oleh Dr. Carey. Yeah. Is there any further?
Can you say why more women in Indonesia are underweight?
Yeah, but looking at the background of Indonesian women, especially the Indonesians itself, it's from the social economy. I think there's still so many people out there that they cannot afford the good quality of the nutrition, I think. And of course, it's related to other social factors such as the educational background and also the economic condition, right? So yeah, I think, well, but it's a big difference with Australia. I think most of the Australian, they could afford the good nutritional food, I think. So, but it's the same. It can cause the problem at the nutritional intake. Yeah. And like what you said before, that the treatment, maybe the education that we give with the underweight and overweight is almost the same, right? Because of the effect of the problem in the nutrition has the same effect on the health reproductive.
Yes, that's right.
Okay.
And while many men and women are aware of the impact of being underweight or overweight on their health, they often don't understand the impact on their fertility health. And it's being able to help them understand what the connections are. And that can sometimes be enough just to motivate change. And then the problem is resolved.
Absolutely. I totally agree with that, because that's become a problem as well, that most of the people do not understand the effect of the fertility, but maybe they know about the effect to the health, but it's not to the fertility itself, right?
That's right.
Semoga itu menjawab ya, Bu ya, terkait dengan gizi tadi. Kemudian let's go on to other question. Maybe mungkin 45 menit ya. 2 or 3 question more. Is that okay, Dr. Carey?
Yes, of course.
Yeah. Okay. How do we as the midwives provide midwifery care to the adolescents who marry at an early age? Who having a unhealthy sexual intercourse at the early age?
Yeah. That's a big question, and I think it would relate to most countries of the world. And I think it comes back again to early education, good sexual and reproductive health education in schools. So that people understand the relationship between general health and reproductive health. If it's provided in schools, and often it is provided in schools here in Australia by nurses and midwives, sexual and reproductive health, then hopefully you'll catch them in time so that they can optimize their health before pregnancy, or use family planning to prevent pregnancy until they're actually ready. So nurses and midwives in school play a very big role in family planning, education and advice to help prevent unintended pregnancy or early pregnancy.
So early education is the key, I think.
It is. It is. Education, as well as making services accessible. So helping
making
people
services accessible. Ya, jadi betul ya, tadi saya juga sangat setuju dengan Dr. Carey bahwa pendidikan lebih dini dan juga akses ke kesehatan gitu ya, itu menjadi kunci ya untuk bisa mengurangi masalah-masalah yang terjadi, baik itu juga terkait dengan tadi ya pernikahan yang terlalu dini gitu ya, karena itu juga akan sangat berpengaruh terhadap kesehatan kehamilannya nanti. Okay, so the next question is bagaimana peran KB di sana dalam pelayanan prakonsepsi? Bagaimana dengan layanan? Oke, ini suku aborigin. Bagaimana pendidikan kesehatan di Australia? Oke, ini tadi sudah dijawab. Seperti di Indonesia masih kental budaya untuk menikah di usia muda. Solusi masyarakat suku Baduy. Bagaimana solusi melakukan KIE pada masyarakat yang memegang prinsip kuat tidak mau mengikuti update ilmu? Mohon. Yeah, Dr. Kerry, okay, we also would like to share you about the problem in Indonesia. So there's still also many, a group of people, we call it as a Baduy, suku Baduy, or maybe if in Australia, it's the Aboriginal group of people, yeah. So most of the people at the suku Baduy itself, they are very hard to receive the new information about the health, the development of the technologies, and etc. So it's not easy to deliver the education and information to them actually. So could you please share us is there any specific or special treatment for maybe it's the same with the Aboriginal, is there any specific behavior that we have to deliver as the health provider to them to encourage them to be more aware to their health?
Yes, a lot has happened in Australia over the last a decade or so around the provision of services to people who generally find it difficult to access them. And so there's been a lot of activism and education in Australia making services culturally appropriate and sensitive so that people feel comfortable accessing the services, and also providing information, education on sexual and reproductive health in materials and formats that they can relate to and understand.
But this is very challenging, right?
Yes, very, very not easy. No.
Yeah,
no.
yeah. We can capture some of the points that you could address there. So yeah, hopefully we can apply as well here in Indonesia.
Yeah.
Okay, so there's one or two questions. Hello, Dr. Kerry. I want to ask question. Before that, let me introduce first. My name is Fauzia. I am a midwife of practical at Pratama Clinic. So most of the participants here are midwives. They have practice at the several healthcare settings, Dr. Kerry. At your presentation about preconception, it must be very important, but Indonesia, especially around my clinic area, any woman that marriage by accident is like unwanted pregnancy, unwanted marriage.
Right.
The woman is not prepared for the pregnancy. So the question here is how the midwives should tell them if that happened and how to tell them about the excellent nutrition. It's actually you have answered about it, about the nutritional. Okay, because it's still difficult in here to give them the education.
Yeah. I think one of the points that I made in the presentation was that if you wait until people are planning to get pregnant or have an accidental pregnancy, it's too late. The education needs to start way earlier in school education, sexual and reproductive health in school.
Oke, baik. Jadi yang ditekankan oleh Dr. Kerry sekarang, jadi kalau kita memberikan edukasi ketika mereka itu sudah mulai memasuki masa persiapan atau bahkan tadi ya married by accident atau pada saat sudah terjadi pernikahan dan akan terjadi kehamilan itu sudah cukup terlambat gitu ya. Jadi yang bisa kita tingkatkan di sini itu adalah pendidikan sejak dini. Jadi sejak awal ya pendidikan mulai pada saat sekolah-sekolah itu adalah yang paling utama gitu ya. Jadi ini pun juga kita tekankan juga bahwa dalam visi kita untuk bisa memberdayakan keluarga dalam prakonsepsi, tentunya ini berkaitan dengan visi STIKes Abdi Nusantara, supaya kita bisa lebih kompeten lagi untuk bisa memberdayakan keluarga pada masa prakonsepsi itu berarti kuncinya adalah dimulai sejak masa dini gitu ya, sejak masa sekolah ya. Jadi kita bisa mulai masuk pada edukasi-edukasi di sekolah-sekolah sehingga remaja baik itu putri maupun pria itu bisa memperoleh pendidikan terkait dengan prakonsepsi ini sejak dini sehingga dia bisa mempersiapkan nanti ketika mereka sudah mulai masuk ke masa prakonsepsi. Dr. Carey, I want to highlight here. So it's highly relevant with our vision of our campus that we need to encourage, we need to involve the family to improve the health of preconception. So the key from your lecture and the statement that I highlight here is that early education about the preconception is the most important thing to involve the family so that they can be more aware in their health reproductive during their preconception later.
Yes.
Yeah. So I think that's the end of this discussion session. And I don't know, it feels so fast. It's been almost 2 hours. You've been delivered your great material and we have a very great discussion. And I believe that it's not enough for us to learn more about it. And we do hope that we could collaborate more in other occasions.
Yes, that would be lovely.
Yeah, thank
I'd like
you so
to do
much.
that.
Oke, thank you so much Dr. Carey. Jadi ini adalah akhir dari sesi diskusi kita karena ini sudah menjelang jam 12 dan ini sudah hampir 2 jam. So later we are going to the last part of this main session. There's an official handover of the e-certificate from Ibu Lia as our leader of STIKes Abdi Nusantara to you, Dr. Carey.
Yes.
Okay, so mungkin bisa dibantu ditayangkan, Ibu Lia, boleh dipersilahkan untuk bisa memberikan, menyerahkan secara resmi sertifikat kepada Dr. Carey. Bu Lia, could you please unmute the audio? Still unmute, Bu Lia? Oh, wait a minute. I'll try to help you to unmute. Okay.
Thank you.
Okay.
Sorry, Mr. Carey. Okay. Thank you. Thank you, Dr. Carey, for the support and your knowledge sharing. Here we officially hand over the certificate of appreciation as the guest lecturer to you. Hopefully, we could continue the future collaboration in the future.
Thank you.
Thank you, Dr. Carey.
I can hear a little bit. It comes and goes. The book.
Yes.
Thank you, Dr. Carey.
Thank you, Dr. Carey.
Thank you, Ibu Lia, for handovering the certificate to Dr. Carey. Okay, so we've come to the last part of this discussion session. Thank you so much for having me. And it's time for me to hand over back to Alia, and I apologize for any mistakes during the discussion session. I wish you are all safe and see you on another great occasion. Miss Alia, the screen is back to you.
Can I just say before I go?
Oh yeah, sure. Could you have a closing statement from you, Dr. Carey, please?
Thank you very, very much for inviting me. It was a pleasure to present, and it was lovely to see so many people in the audience. And it was a beautiful way to start the singing. Singing is so good for the soul. I loved that, and thank you for the questions. So thank you very much. And
Thank you very much.
how amazing that you can translate, listen and translate. I think that's an amazing skill. So thank you.
Thank you so much, Dr. Carrie.
Okay. Would you like me to leave now?
We still need to do the documentation session.
Oh, okay. So I stay. I stay.
Could you please stay with the on camera? Okay. Okay, Miss Alia, the screen is back to you.
Thank you, Miss Melissa. And thank you so much, Dr. Carrie. It's our pleasure to get a new lesson and new perspective about preconception in midwife. The next agenda is documentation. Dimohon peserta kuliah pakar untuk membuka kamera.
Thank you.
Okay, we're still capturing the screen.
Dan dimohon untuk peserta kuliah pakar untuk mengisi absensi.
Oke, sudah selesai ya dokumentasinya, Mbak?
Yes.
Okay, thank you, Dr. Carrie.
Thank you very much.
See you later.
Okay. I wish you all well.
Thank you.
Bye.
Bye.
Okay, the next agenda is closing. To close the seminar international event today, let's all participants in this meeting conference say hamdalah together. Alhamdulillah. Finally, from the deepest of my heart, I do apologize for my mistake in presenting this event. Thank you so much for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hidup adalah perjalanan yang penuh tantangan.
Dan terkadang bisa menjadi tantangan untuk mencari rumah baru, untuk menemukan kebenaran, untuk berteman.
Agar berhasil beradaptasi untuk membuat dunia menjadi tempat yang lebih baik.
Di sini, di STIKes Abdi Nusantara, kami mengatasi tantangan ini dengan kata sederhana. Kami hanya menyapa dan itu mengubah dunia. keistimewaan terbesar dalam hidup manusia.